This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Ollie.
Welcome, everyone. We have a super relevant and timely episode, as today is the day for the publication of International Society for Physical Activity and Health's 8 investments that work for physical activity. And we have a chance to have a chat with the very people behind the document, Dr. Lindsey Reece and Reece Mclaughlin. Matthew is doing his PhD at the University of Newcastle, Australia, related to health service delivery in large physical activity program in schools. He is the chair of the communication committee at ISPAH. Lindsey holds a PhD in health and medical psychology and is working as a principal researcher at University of Sydney. Lindsey has extensive experience in applied research and evaluation, specialising in physical activity, sport, and public health. Within her current role as a research fellow at the University of Sydney's Prevention Research Collaboration, she is the director of the Sprinter Group, an innovative research partnership with the Office of Sport. Lindsey is visiting the podcast for the second time, and I really recommend checking the episode related to PA comms and policy. Ladies and gentlemen, please welcome our guest, Dr. Lindsey Reece and Reece Mclaughlin. Welcome, Lindsey and Matthew.
Hi, Ollie.
Hi, Ollie. Thanks for having us back again.
Yeah, great to have you. So we have been talking about the document and 8 investments. Should we go through what are the eight investments that work for physical activity?
Sure, I'll let Lindsey kick off with this one.
Yeah, so I'll this is a bit of a memory test. I'll see if I can go through them in order. I would say so number 1 in the document is the whole of school programs. So this talks to a lot around the education. It talks about building in multi-component programs throughout schools. So we have number 2, which is active travel. And this really is thinking about integrating, because travel occurs in most people's everyday lives. It's about looking at active ways to travel and commute. Then we have number 3, which is active urban design. And this really draws on a lot of international evidence and the recent Lancet series on urban design and transport. And that's really focusing on building active, healthy cities. And then number 4, we have primary healthcare. So this really talks to primary care-based interventions, whether that's focusing on physical activity alone or focusing on other risk factors such as tobacco control or cardiovascular disease. And just because we're a partnership for number 5, I will throw to Tepe to take you through the rest.
Love it. So the 5th one is public education, including mass media. And so this one's looking at, and even the imagery that we've used in the document just really stands out, is that overarching strategy that can be linked to quite a few of the other investments around communicating physical activity messages. And there's a combination of approaches that can be used for that, and there's evidence of which ones work and don't work that are included within that investment. The 6th one is the one that Lindsey and I worked on, which is the sport and recreation for all. And I think sport has had a big shift over the last few years in terms of the participation has shifted from organised sport to more social and less organised sport, which is acknowledged in the document, and it talks about the different benefits of sport, not only to the health benefits, but also identifies those other benefits to other sustainable development goals really clearly. The 7th one is workplaces. So this one has similar to the schools approach, talks about kind of workplace health programs and what can be done, and really like the imagery on this one of people stretching before work is as an example there of kind of a workplace health program. And then the final one is community-wide programs, which is a concept that often gets a little bit muddled with systems-based approach. But community-wide programs is about offering more than one thing to tackle physical inactivity, and that in a more in a combined approach. So there's some really great evidence cited within each of them. But I think the 8 investments, they target different settings. So you've got the schools, you've got the workplaces, and you've got the healthcare, which is 1, 4, and 7 investment. But then you've also got the sport, and then you've got that kind of built environment around active transport and built environments, urban design. So I think they really do cover all levels of that, or more levels of the ecological model. They don't just focus on the individual. They definitely focus more on the environment as well, which is obviously key.
Yeah, and they talk to so they talk to the different settings, and they also talk to different parts of the population. So it really does give you that life course approach from, you know, children and young people coming from the school settings right up to, you know, workplaces and adulthood. And then, you know, it really does give you that life course approach. And I think one of the key questions we often get asked is, you know, is the 1 to 8 in a hierarchy? So should we prioritize schools over community wide? Is that why you've got 1 to 8? And I can definitely, you know, bust that myth and say that's not the case at all. Each investment is equal. The decision around prioritizing which ones to focus on, if you know, can't possibly do all 8 in your, if that is the case, it's about choosing looking at your local area and choosing which investment, you know, applies for you at that moment in time. So that really does depend on your context and your environment. So my advice to everyone looking at this is there isn't a hierarchy. It's dependent on your local context, and it's choosing which one is a priority for you in your area.
So there's a lot of stakeholders, a lot of levels. You have healthcare, you have urban designers, you have media, you have workplaces. So many stakeholders. How can you get all these stakeholders to see, read, and act based on this document? It's quite challenging, I would guess.
It is a challenge, and that's one of the reasons why ISPAH's taken, you know, ISPAH has this global presence, and it's one of the reasons why we have the 8 investments document. It's also why we call, you know, everyone everywhere to really join the conversation and be advocates, because just like there's no single solution, there's no single person, or there's no single setting, or there's no single investment that's going to work. So we need to unite everybody, recognizing that is a challenge, but that's one of the reasons why ISPAH is such a wonderful organization, that it really brings people together to try and get that consensus. So one of the ways of overcoming that is to join the conversation, learn from each other, share knowledge and insights, share what works and equally what isn't working, because that's really important. And that's by having those open conversations, which ISPAH is providing the platform to do that. This document through social media and the hashtag 8investments really does give you a platform to have a voice, but also to listen to others as well around the world. And hopefully by bringing everyone together to share, we can then advance and learn from each other.
Yeah, I think adding to that, it's look back to what Lindsey was saying earlier about everyone being an advocate, which means that everybody's kind of helping with sharing this message and advocating for it. Of course, advocacy goes beyond the sharing, but that's the kind of a nice first step. And that's why it's really important that we get as much traction as we can with the hashtag 8, the number 8, and then investments on social media. So people can check that out. I'm sure there'll be a big blast today on social media.
Yeah, but Ollie, that's a really important point because it's not easy. And and to listeners out there, all of us, as much as this document gives you some of the solutions, we recognise that this isn't easy. If it was easy, we'd be doing this a lot earlier. So if you're out there and you're struggling and you think, I'm continue to have the conversations, hang in there because we are all in it together. We will have good days, we'll have bad days. So that's why it's so important that we come together and have these conversations, because this stuff isn't easy.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behaviour change in sedentary behaviour and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
I wanted to ask about the level of evidence. If I play devil's advocate, some advocacy here. So if somebody is kind of skeptic about these, everybody's advertising that what they are promoting, it brings the return on investment and so on. What is the evidence of these 8 investments that they really work and bring return on investment?
There's some really strong evidence cited within each of the investments. And I love the use of the word devil's advocate, because that's really important, because it is important that we are sharing the right investments. And these investments have come from the consensus within ISPAH, and they do cite some really great evidence. And like I say, that evidence has updated since the 7 investments, but a lot of the evidence was there 10 years ago for these investments. So I would just say that if people do have kind of questions about the strength of the evidence, that they can go and take a look at what's cited, and there's some really useful citations in there for people wanting to know what's the best evidence and what's cited.
And I think it's important to mention that, different investments have got different levels of evidence. I know from, working across sport, for example, sport is in a very different place to, when you look at the evidence around primary care and the benefits of physical activity for prevention of chronic disease. We're still working really hard to understand the role and contribution that sport has in that space. But there is overwhelming evidence to suggest that being physically active can prevent, manage and treat chronic disease. It can, save the economy. It has societal benefits. There's overwhelming evidence that that's the case. What we need to now focus on is supporting people to really challenge the inequities that exist within physical activity. The Global Action Plan for Physical Activity also is an excellent point for raising awareness of the evidence, and that talks to the inequities that still exist. So we still recognise that there are gaps in the evidence, and we need to generate the science for how we get more of the inequities in participation a little bit closer. So how we focus on getting more women and girls physically active, how we look at low and middle income countries, how we look at people living with a disability. So we recognise that there are gaps. But I think it's important that we come back to the position of, we know that being physically active on a regular basis has numerous co-benefits for beyond health. That's just my bias, which is why I draw on those. But we would be naive to say that this has got the evidence for everything. There are elements where it's growing, but we have to remember that there is overwhelming consensus that being physically active is positive.
And I think one more thing to add to that is that there is no single solution. So looking at them in isolation is not what we're asking people to do. It's about kind of combining the 8 investments, and as Lindsey talked to earlier, about combining the ones that are feasible within your setting, your community, your influence circle, to see what will work in your setting.
And if there are research ideas, if people are listening, and ISPAH is really keen to engage the research community. So we want to hear all the positive work on how people are using the 8 investments within, their areas, and we want to hear from people how they're using it. We want to hear about the good research that's happening to inform, the next iteration. So I think that's where the 8 investments, we hope, can be a really good platform to have those conversations and share the knowledge and insights.
And if we still stay a small moment in the evidence, how is the evidence in this kind of case? You are talking about systems approach. So is the evidence from certain countries or destinations where something have worked, or is it more like interventions, or how does it work? How does this kind of research work when it's really complex and a systemic thing?
So I think, as Tepi's alluded, that there is a synthesis of evidence within each of the investments, and obviously that speaks to that particular area. So if, for example, we were looking at active travel, that particular investment draws on a lot of evidence from Belgium and France. Whereas, for example, within sport, it draws on literature from around the world, some Australian evidence. So I think that's a difficult question, because every investment has slightly different evidence in terms of the quality, the level, the area. But every author of each of the sections has a very systematic and robust approach to reviewing the evidence. All of the co-authors for each of the sections are internationally recognised in their own right. And I think they really do jump into the detail about the evidence in the podcast. So I would definitely signpost people to the website. And if there's a particular investment where you're really interested in the evidence and how that came about, then I would really recommend people listen to the authors of each section, because I think that's really key. But I think, to Tepi's point, this isn't around this is no means a fully extensive literature review, or there's we haven't published all of that. That's rigorous behind it, but I think it's important to recognise that this is a collective body of work that really is around translating the evidence into policy and practice.
And I think it goes back to the earlier point around providing a consensus on what works is really important. So I know that the Don, shall we say, of physical activity advocacy over the last few years, Professor Trevor Shilton, who led this document, it always uses an anecdote, which I think is really useful, that if you phone up anybody that works in tobacco control, the leading experts, they'll all give you the same answer as to what works to control tobacco. And this document goes somewhat, for physical activity, towards getting towards a stage where we are in a similar place, where we try and have a consensus on the things that should be invested in to improve physical activity. So just as an example, if you go into one of the investments, it isn't strictly prescriptive as to exactly which part works. So under the active travel, for instance, it doesn't say at the micro level, it is this specific design of cycle path that works. Of course, there are different things, different levels of evidence for things within each of the investments as well. But I think it's important that what the document's trying to do is provide a consensus on the areas for investment. So in the different settings, so that the schools, the workplaces, healthcare and sport, but also across the environment as well. So those built environment and urban design and transport systems, as well as the public education stuff as well. So I think it's about the consensus, and that's where this document's real strength is.
For sure. And I think it's around applying this within your own context, because it would be inappropriate for a global document to come out and say every school around the world needs to do X, or the sports sector with every world. Every context and every environment is very different. So the purpose of this document is to provide a consensus, so we know what works when we're looking at having physical activity conversations, and then it's around translating and adapting it in your own context. I think that is really important.
Yes, and so you are talking about the document, and it's about 20-page document, but you also have other resources available for people. Could you tell more about different resources and who those are directed to?
Sure. So, it's easy to say that, we've both said it on this podcast, that everybody should be an advocate. But, people need to know, and I certainly was one of those people that kind of needed the tips on how to advocate. So in our website, and I'm sure we can provide the link for that within the show notes, the document is up there in the 6 United Nations languages. So we've already commissioned some translations. We also have a full advocacy toolkit. And within that advocacy toolkit, we look at 3 things. We look at share, endorse, and feedback. And in the share section, we've provided things like a social media toolkit, template letters for you to send to your stakeholders and your colleagues. We've got our media release up there. We've got a PowerPoint presentation that you can use to discuss with colleagues and stakeholders. So we've really tried to support people to talk about these 8 investments. And so that's within the share section. Within the endorse section, and Lindsey said before, both Lindsey and I were on the Australian time zone, have endorsed the document already. And so you can go to the website, and as an individual, you can endorse the document. And also as an organization, you can endorse the document. And we'll be listing those on the website of the people that have endorsed. And finally, it's about feeding back and letting ISPAH know how you've used this document, how you're advocating for physical activity in your setting, in your environment, your bubble, whatever you want to call it, your circle of influence. And they're the 3 calls. They're the calls to action. So share, endorse, feedback. And of course, always using the key hashtag when we're on social media, 8 investments.
There's also a really great animation. I mean, Tepi's done a wonderful job of just going through all the resources, and there are lots out there. And if we have missed something, feel free to give us feedback. And if you feel that there's something else that you think, you would like out there and that might help others, so feel free to share your tips and ideas.
So to recap, we will have the link in the show notes, and you would like the listeners to go there, share, endorse, and give feedback about the document and the resources. Did I get it right?
Absolutely, yeah. And of course, read the document is our first one. So encourage people to read it in their language of their choice of the 6 United Nations languages, and then share, endorse, and feedback.
So we invite you, Ollie, to also do the same. So we welcome you to have a little read, endorse, and share it with all your listeners too.
I will definitely do that, and we talked with Matthew about other ways also of communicating this, but we will see those later. Is there anything else you would like to add of these eight investments in the discussion?
Just that it's been a really great process to get to this stage, and a great team effort by all of the people that have worked on the document, and also the advocacy kit and website. ISPAH is a volunteer organisation, and everybody's really pulled together to produce this consensus document.
I second that. This really is a team effort, and it's been an absolute delight to be a part of the process. And yeah, as much as me and Tepi are here talking to you today, it really is a team effort. So yeah, we just want to acknowledge everyone's kind of hard work, passion, and commitment to getting the toolkit to where it is. And we're excited to see where it goes.
And how do you see now? These are the update for 2016. So I don't know if it's the time in 2024 to make the next ones. If you try to predict the future, what do you think will be different in the next versions? Is there something that's going to come up in future, in next years?
Oh, that's a very tough question. The just to highlight, the previous one was released in 2011, so we have given it almost 10 years since the last one. But for the future, I think that's a really difficult question. I don't know whether you've got any thoughts on that, Lindsey.
That is a tough one. I think, to be honest, with the launch today, I think this one's enough for the minute. I think I need to lie. As much as we talk about physical activity, I think I need to lie down. I think probably I would see, or I'd like to see, a real concerted effort to support advocacy in a evidence-based way. I think we could do, whether it will be an investment piece, I'm not sure, but I would personally like to see some support for advocacy training and some more resources, because I think, coming from my personal background, I've never been trained in advocacy, haven't necessarily, I'm learning the skills as we go along. So I'd personally like to see a bit more training and support for advocates. And I think for me, it's also building the knowledge base around systems and of how we evaluate systems. I know there's some excellent work going on in the UK around that at the minute. But I think there'll be a growing evidence base for the implementation and the evaluation of systems and what that means and what that looks like within physical activity. Whether there'll be investments, I'm not sure, but in terms of where the evidence is going in the physical activity space, I would personally like to see, that's where I kind of personally think it may head. But yeah, that's a tough question. Maybe ask us that in a little bit of time when we have a chance to lie down.
Yeah, apologies for throwing you under the bus, but yeah.
No, it's all good, Ollie. I've been on here before.
Yeah, I think you are doing amazing work. I think it's a really important document, and I think it's important to see this kind of bigger picture, because earlier I think it's many times like researchers doing some certain area and trying to promote those ideas, but you really bring together the whole picture and try to influence a lot of stakeholders. And then you also have this advocacy part, how to promote it. So congratulations for the team. I think it's really important work you're doing. What would be your final remarks for this episode?
Mine would be a really upbeat call to action for everybody listening. It's really important that we read, share, endorse, and feedback on this document. And let's get it used. Let's advance physical activity.
Yeah, and I would say that's all we can do is try. And I would encourage everybody to be an advocate for this document, draw on the resources that are available on the ISPAH website, join the conversation using the hashtag 8, which is the number 8 investments, and let's learn and share from each other.
Those were good final remarks. Thank you, Matthew and Lindsey, for being in the show.
Thank you, Ollie.
Thank you so much for having us, Ollie.
Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcast or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.